Hi, everyone. My name is Jessica. Me and my classmates, Nicole, Jason, Caileigh, Emily, and Tia, are here today to discuss the important role that Planned Parenthood plays in our community. As future social workers, we are hoping to show you through factual evidence and information how crucial these services can be. Planned Parenthood provides a wide range of essential healthcare services such as reproductive health care, cancer screenings, STD testing and treatment, contraception, and more. They serve millions of people of all demographics, including women, men, and young people, ensuring that everyone has proper access and education to the care they need. Planned Parenthood is necessary because it makes healthcare accessible and affordable for all, regardless of their financial status. This organization impacts countless lives by offering these services and maintaining the overall health and well-being of our community. It's important that we continue to advocate funding for Planned Parenthood because their work is an essential part of our community. The funding they receive, which comes from governmental support, donations, and grants, allows them to keep providing these services at low or no cost to those who need them the most. By supporting Planned Parenthood, we are not only investing for individuals who need it today, but investing in the health and future of our community.
Hi everyone, I'm Nicole. So we're going to talk about what areas of service Planned Parenthood provides. So when most people think of Planned Parenthood, they only think about one service it provides, abortion. While abortion is an important area of service, it is just one of the healthcare services provided by Planned Parenthood. In addition to abortion, Planned Parenthood provides pregnancy testing, pregnancy dating through ultrasound, abortion referrals, medication and procedural abortions, multiple birth control options, including implants, patches, pills, shots, vaginal rings, cervical caps, diaphragms, condoms, IUDs, vasectomies, and more, morning after pills, HIV testing, treatment support and referrals, PEP, post-exposure HIV prevention, PrEP, ongoing HIV prevention, mental health care, including anxiety, depression, unhealthy relationship, and substance use support and referrals, fertility and pregnancy planning, infertility support and referrals, pregnancy options, counseling and adoption information and referrals, prenatal services and referrals, postpartum visits, miscarriage care and support, and early pregnancy concerns, including pain and bleeding, sexual and reproductive concerns, STD testing and treatment, gender affirming care, including estrogen and anti-androgen, hormone therapy, testosterone hormone therapy, puberty blockers, surgery referrals, and social and legal transitional support, hepatitis B, HPV, COVID-19, and flu vaccines, cancer screenings, annual wellness visits, and other preventative care. Needless to say, Planned Parenthood covers their bases and provides many healthcare services to a variety of individuals. Healthcare is only one aspect of Planned Parenthood. Education and advocacy are the two other major avenues of service. In regards to education, Planned Parenthood provides sex education. These services are provided to schools, in summer camps, outreach workshops, peer education groups, and more. Additionally, a major part of Planned Parenthood is advocacy work. This includes lobbying, outreach emails, phone calls, and text messages, as well as events. I'm going to pass it over to Jason now.
Excellent. Thank you for that, Nicole. So my role, me being Jason, I'm here to explain to you who does Planned Parenthood impact. Well, Planned Parenthood provides its extensive services to a wide variety of demographics in America, which display its massive vitality. The organization reaches individuals across various income levels, multiple races and ethnicities, diverse genders, different ages, and varying marital and family statuses, and different insurance coverages. I want to show you and highlight some key percentages found on the different groups using Planned Parenthood on local levels serving Suffolk, Westchester, Rockland, and Putnam County. Here, we can see in terms of health insurance used, one of the demographics that stick out here. You could see under the insurance, Medicaid, which is a joint federal and state program that gives health coverage to individuals with limited income and resources, is at 63%. Also, if we look at the income, I find it very interesting to see how the highest income places second, almost tripling over the 151K and 200K. This just shows that regardless of income status, these health services are needed by everyone. If you look at the age, individuals after their 20s still seek and need these services. Most of the public stigma sees Planned Parenthood as a program geared more towards teenagers, young adults, and women, with most services promoted being STD checks and pregnancy services. However, their role play a large part in the health of older demographics by conducting services like breast exams, colpus, colposcopies, and leap visits, and vasectomies. In 2023, 5 locations across Suffolk County, Huntington, Patchogue, Riverhead, Smithtown, and West Islip, had about 18,000 health center visits. This number represents our neighbors, classmates, peers, and family members who have taken advantage of health services provided by Planned Parenthood. With nearly 600 health services across the U.S., Planned Parenthood leads in the mission to empower individuals to determine their own sexual health and reproductive futures. Some key statistics. Last year, Planned Parenthood offered services to over 2 million patients in the US, with an additional 2,840,000 patients served by Planned Parenthood affiliate health centers. And out of these patients, 87% of them are ages 20 and older. 67% of these patients have an income at or below 150% of the federal poverty level. Going to a global stage, Planned Parenthood serves impact communities huge. Every year, Planned Parenthood provides nearly 4,665,000 men, women, and children worldwide with sexual and reproductive health care and education. For over 40 years, Planned Parenthood has taken its commitment to education and health services internationally. With 80 organizations spanning 12 focus countries, they aim to promote and advance the health and rights of individuals globally. Aside from the 12 countries in Planned Parenthood's network, like Peru, Costa Rica, Ecuador, Ethiopia, Senegal, and Kenya, the organization also serves an additional 25 countries and territories on health services and education outside its infrastructure, serviced by Planned Parenthood Global's reproductive planning outreach. With half of the world's population now under 25, and pregnancy being the leading cause of death for adolescent girls worldwide, with nearly 70,000 killed annually from complications related to pregnancy and childbirth, the time to spread awareness and highlight the importance of Planned Parenthood is now. Supporting an organization that strives to provide critical health services and education that impacts all of us locally and globally is fundamental to reaching a healthy, equal, and just world. Thank you.
Hi, I'm Caileigh. Now I'm going to talk about why Planned Parenthood is important to our community. Planned Parenthood is important to our community. Planned Parenthood provides care for our community, like LARCs, placed HPV tests, breast exams, breast exam procedures, abortion visits, gender-affirming care visits, prenatal care visits, HPV vaccinations, PrEP exams, and PEP patients visits, emergency contraception visits, vasectomies performed by visits, and STI tests, as previously mentioned. Planned Parenthood also provides education to our community, including a sexual and reproductive health training program called TIPS to become a peer educator, and summer camps as well as training to become bilingual peer health educators. Planned Parenthood serves Suffolk, Westchester, Rockland, and Putnam counties in the New York area. Planned Parenthood being in Suffolk County, Planned Parenthood is necessary in our community. Suffolk County alone served 17,704 patients. Planned Parenthood is vital to our community, and if Planned Parenthood were to go away, our community would suffer and the damage would be irreparable.
All right. Hi, everyone. In order to understand why we should continue to fund Planned Parenthood and all the services that they provide, it is important to know the funds that Planned Parenthood receives in order to provide these things. So funding for Planned Parenthood is funded through multiple sources, and these include grants from government agencies, predominantly the Agency of the Health and Human Services, Medicare and Medicaid, and donations from individual foundations. This agency is essential to communities, especially individuals in lower income areas, considering Planned Parenthood serves approximately 1.5 million individuals through Title V, which is a federal program that funds agencies and programs that are in service for family planning and preventative health services. By taking away a resource that provides services besides what the agency is known for, society would be doing a disservice to lower income communities. As a social worker, it is essential for clinicians to be aware of the resources available in your area, as to have a valuable center in your toolbox that you can share with clients when in need of medical services or a variety of products provided, which is paramount to the success of a community and the clients within them.
Okay, hi guys. So to wrap everything up, Planned Parenthood is a lifeline for millions of people, offering crucial healthcare, education, advocacy services that makes a real difference in our community and beyond. They provide a wide range of essential health services like cancer screenings, STD testing, birth control, gender supportive care, mental health support, and more. They also educate communities through programs like peer health training and workshops, empowering people to make informed decisions about their health. Planned Parenthood impacts people of all ages, incomes, genders, and backgrounds. Locally, they serve thousands of individuals, including nearly 18,000 health center visits in Suffolk County alone, helping our neighbors, classmates, and families access the care they need. Globally, their programs provide crucial health services and education to communities around the world, improving lives and creating opportunities for a better future. Without Planned Parenthood, many people will lose access to affordable essential health care. This would harm individuals, family, and entire communities. Their funding comes from government grants, Medicare, and donations, ensuring that low-income individuals and underserved populations can get the care that they need. This is not just about policies or politics. It's about people. It's about standing up for those who cannot always stand up for themselves and recognizing that access to healthcare is not a privilege, but a basic human right. Let's keep Planned Parenthood thriving, because when they thrive, we all thrive. Thank you.